Okay, well, welcome everybody to the senior seminar presentations. We have just two presenters today. They will be Caitlin Wilson and Kai Hymanen, who you heard from on Wednesday at the poster session. And again today, if you would keep yourselves muted until, unless afterwards you have a question, we can open up for audio. But up until then, just keep your mute on. And then any audio questions you can hold, but if you feel like you need to type out a question in the chat as it comes up so you don't forget it, feel free to do that, and then we'll ask the presenter afterwards. So our first presenter is Caitlin Wilson, and she is graduating this semester with a biochemistry degree. Her plan is to apply to graduate schools now in different cancer biology programs. And something that you might not know about Caitlin is that she was almost attacked by a bear when she was 3 years old. And we know that, no spoilers here, but she was not attacked by the bear. And so she is here today to present her research on phytase. She is a student of Dr. Johnson's, but I adopted her when Dr. Johnson became dean. And so Caitlin, whenever you are ready, you can share your screen and let us know what you have found about phytase.
All right. Hi, everybody. I'm assuming you guys can hear me. Okay. So let's begin. So my project is based off of the isolation of the phytase enzyme for Ochrobacterium anthropic, as well as an evaluation of the efficacy of commercial phytase enzymes. So to begin, phytase is a digestive enzyme that is found in ruminant animals such as cattle or sheep. So phytase initiates the hydrolysis of phytate or phytic acid into myoinositol monophosphate, as well as inorganic phosphorus. Phytate is a chelator of essential minerals such as copper, magnesium, zinc, iron, and calcium, and therefore is available for uptake into the digestive system when phytase is present. So phytic acid and phytate are both abundant in plant products such as roots, tubers, seeds, soybeans, corn. The typical livestock diet is comprised of corn and soybeans, which are both have high concentrations of phytic acid in them. Unfortunately, non-ruminant animals such as swine, poultry, and fish possess little phytase activity, and therefore the phytic acid in their grain-based feed is released in their manure, typically undigested and unprocessed. And due to the increase in the agricultural industry, we see pools of this inorganic phosphorus in the soil. And through surficial and ground runoff systems, we can see an increase in the level of inorganic phosphorus in bodies of water. That leads to increased levels of algae blooms, and this attributes to hypoxic water conditions. And with the decrease in oxygen in the water, this stresses the metabolisms of the microorganisms, and this leads to a subsequent loss of biodiversity. So this really isn't a sustainable process for aquatic ecosystems. However, when we use a commercial phytase coating for these feeds for these non-ruminant livestock, we can see a decrease in the total phosphorus waste by almost 20 to 50%. And as a result, these non-ruminant animals now have access to these chelated molecules and essential minerals. We can also see phosphorus being included in the diet, and we can see an improved production parameters as a result. We see increased weight gain and growth rate, as well as bone mineralization and strength. Therefore, it is important to find diverse sources of the phytase enzyme with a range of properties such as pH optimum, thermostability, and proteolytic resistance to remain stable in the unique biological environment of non-ruminant animals. Dr. Johnson's research was overarchingly aimed towards gauging the potential of different sources of phytase for animal feed studies. However, my focus was more along the lines of isolating a phytase enzyme from the Proteobacterium, Ochrobacterium anthropic. This was done by first extracting the target gene. We started with a glycerol stock that contained the PET30 plasmid that contained the phytase enzyme on it. This was done in order to isolate the plasmid using a plasmid mini prep. Then we cloned the DNA into the expression vector. We used restriction enzymes to cut out the target DNA and used DNA ligase to ligate together the open vector and the DNA sequence. The expression vector was used because the gene is under the control of the lac operator, so we can control the expression of the protein or the production of that. We then transformed the plasmid into competent E. coli cells. And these E. coli were made competent by using a calcium chloride solution and also heat shocking, so that the cell walls were altered so that the vector could be incorporated into the cell. We then induced expression of the phytase by adding IPTG. So IPTG is an inducer and triggers the transcription of the lac operon. So therefore, the expression of the phytase is initiated in the E. coli cells. However, this is as far as we made it before we went online, so I had to transition into like a blended literature project. So I wanted to focus on the overarching goal, which was the potential for subsequent animal feed studies. So I wanted to look at different commercial phytase enzymes. So my research was aimed towards aiding in chicken farmers making the most advantageous purchase for their livestock in terms of fattening. So I evaluated the efficacy of Ronazyme by DSM Nutritional Products and Phyzyme by Danisco Animal Nutrition in terms of both stability during variable storage conditions, as well as the primary purpose of the enzyme, which is to make phosphorus bioavailable. So I looked at the parameters of bone mineralization and weight gain. I also looked at percent mortality to see if there was an enzyme that was more safe than the other. These two graphs represent the enzymes on a coated feed being stored in variable environmental conditions. They were stored at 0, 41, and 73, and 99 degrees Fahrenheit. And at 99 degrees Fahrenheit, the feed was also stored in a chamber with 75% relative humidity. This was measured in terms of percent of initial phytase at day 0 over 120 days. Phyzyme actually exhibited the highest percent of initial phytase activity for temperatures that were less than 73 degrees Fahrenheit, as opposed to Ronazyme. And at day 120, there was over 85% of the residual phytase activity for temperatures 73 degrees Fahrenheit and less. This indicates that Phyzyme is a more stable product and it will retain higher activity when being stored for farmers. Excuse me. The next parameters, such as weight gain and bone ash determination and percent mortality, were used by looking at the European Food Safety Authority opinions on these enzymes. These opinions were performed 2 years apart, so their parameters were a little bit different. Both were pen studies that were chickens for fattening fed graded levels of the enzyme alongside their typical basal diet. However, for Ronazyme, the study lasted 30 days and the chickens were weighed at that final day. As for bone ash determination, the tibia bones of the chickens were excised at day 7 and 22. Whereas for Phyzyme, the study lasted 42 days and the weight gain was determined then. Whereas for bone ash determination, this was determined after the 3rd and 6th week. As for weight gain, these were measured in final body weight per grams per bird for Ronazyme, whereas for Phyzyme, we saw it in weight gain. As for Ronazyme, there was a significant increase in the weight gain at a dosage of 1,000 at 1,636 grams per bird, whereas for Phyzyme, there was a significant increase at day 42 at 750 at 2,247 grams. This indicates that Phyzyme was a lot more effective at a lower dosage than Ronazyme. And actually, even though it was only 12 days longer of a study, there was a significant increase in the body weight as well. This slide represents the bone mineralization in percent of dry matter for the chickens for fattening fed the graded levels of these enzymes. So percent of dry matter is a reflection of the inclusion of the phosphorus in the bone. So the tibia bones were excised and the ash was determined. And the theory behind that is if there was a higher level of phosphorus inclusion, there would be higher concentrations of both calcium and phosphorus, leading to a higher mass of the ash content. For Ronazyme, there was a significant increase in the tibia ash content at a dosage of 1,000 with 45.5% of dry matter. Whereas for Phyzyme, at both 500 and 750, there is a significant increase at 51.9 and 52.7. This is a similar trend as before, with lower dosages yielding higher results for Phyzyme. As for mortality, the European Food Safety Authority determined that both enzymes were safe for both chickens and handlers, and tolerance studies were performed for both enzymes. For Ronazyme, there was a tolerance study performed for 3 times the maximum dosage at 30,000 FDU per kilogram feed, and there was no significant increase in the percent mortality, nor were there an impact on the performance of the chickens. Whereas for Phyzyme, there was a tolerance study performed at 7.5 times the minimum dosage with similar results. So both enzymes were safe, and we don't really need to consider that moving forward. So in conclusion, Phyzyme was a more stable enzyme in different environmental conditions. It had a higher percent of residual phytase when stored. It also yielded greater weight gain and concentration of tibia ash when using Phyzyme as opposed to Ronazyme. And the weight gain in tibia ash was significantly increased at lower dosages. This means that farmers could use less of a product and yield better results than the competitor, making it an economic choice. Therefore, I believe the data supports that Phyzyme is the most advantageous purchase for farmers in terms of both phosphorus inclusion and stability. Now, does anybody have any questions? You guys can leave them in the chat or ask right now.
Are there any questions from the virtual audience?
Caitlin, this is Dr. J. I got a question for you.
Okay.
So you showed one of the initial graphs you had showed the activity and residual activity at various temperatures.
Mm-hmm.
Can you reiterate why that's important to the end user of this, which would be the farmers?
So the end user, okay. So that is a really important question. That's why I chose to do that study and provide that data, is because it's directly a reflection of how efficient is your feed in that enzyme going to be after you're storing and buying large quantities of that enzyme. You're obviously not going to use that at overnight. You buy in bulk, farmers do, and you can't really control necessarily how your feed is being stored, but knowing and having confidence that the enzyme is going to be more active at 3 months later, if it's a hot summer, you're in the South, and you can have confidence knowing that this is going to perform almost as well as it did at day 0, that makes it a more valuable product to the farmer. Did that answer your question?
Yes.
Any other questions? I have one for you, Caitlin. If you can go back to that graph with the conditions.
Okay.
And this, I just found this interesting that at 40 degrees, which would be, I'm assuming about refrigerator temperature, it started to degrade out to 3 months, whereas storing it at room temperature or 0 didn't. Did they offer any explanation for why it was worse to store it at refrigeration temperatures? Do you know if there's a reason for that? Or could you speculate?
They talked about processes during the pelleting process, maybe altering the thermostability of the enzyme. And it was kind of, they performed these studies because there was a lack of studies being performed after the pelleting process. So they didn't really know what how the enzymes were affected after that process. Okay. So we know the initial thermostability of the enzyme, but the pelleting process is altering them, I guess. So
Okay.
they wanted to kind of have an insight about what was happening after that during storage.
Do you know, did they control the humidity at each of these temperatures so that was the same in all of the conditions, or was it just different, or whatever the conditions were, if that makes sense?
I think that they just stored them at these temperatures, but really only controlled the conditions of the 99 degrees Fahrenheit chamber.
Because I didn't know if in a refrigerator there's more humidity. If they were storing it at 40 degrees, that would affect why it's losing activity at 121 days versus freezing it or at room temperature.
Yeah, that's a really good question. They didn't really offer too much explanation about why they chose these specific temperatures either. So
Thank you.
no problem.
Any other questions?
I have another one since we're on the temperature discussion. Caitlin, in what format is the enzyme? Is the enzyme already on the food pellet?
Yes, it was coated on the feed.
And so, what conditions are it under, or what conditions is it exposed to during the pelleting process? Does that have any impact on temperature and stability?
I think that they were saying that the pelleting process, it's a lot of pressure on them. So I think that increases the heat of the individual grains. But I'm not really sure, but I can get back to you on that. I can try to find something about that.
Okay, I won't rest until I hear back.
Okay,
Thanks, Caitlin.
no problem.
Other questions? All right, thank you, Caitlin. All right, so we have a brief intermission for the junior seminar students here. Hang on just a second. And also for USEM students. I can pull up my screen. Technical difficulties, I apologize. All right, there's your secret word of the day while Kai is getting set up. So Kai is also graduating and he is applying to medical schools, and hopefully we'll hear something from him soon. So he is doing a literature project about melanoma. And some of you may not know about Kai is that he recently became a dad. So he has a 2-month-old baby girl at home. All right, so junior seminar and USEM students, if you got your secret word of the day, soon that will go away. And I guess you can check the recording after the fact here. So Kai is going to take over the screen here whenever you're ready, Kai.
Yep. So I hope everyone can see that clearly, and I hope little Sophie doesn't make too much noise. She's sleeping right now, so hopefully it stays that way. Okay. So I did a literature review on the methods for and possible advancements in the detection of malignant melanoma. And this is what melanoma can look like on the surface of your skin. So melanoma is the deadliest form of skin cancer. It is estimated that there will be about 100,350 new cases and 6,850 deaths for the year 2020 in the United States. This survival rate has been increasing very quickly over the last few decades. The risks do increase with age. However, it is one of the most common cancers in young adults. Reducing overexposure to ultraviolet rays by wearing sunscreen or protective clothing, avoiding tanning beds, all may reduce the risk. So this picture is an animation of what it looks like when melanoma begins to spread from the epidermis to the dermis layer of the skin. And if melanoma metastasizes, the survival rate decreases to 25%. So symptoms of melanoma include itchiness, bleeding, skin irritation, pain, redness, and swelling. These usually begin to occur when melanoma starts metastasizing, which means the detection was too late. These are some of the current detection methods: full body photography, dermoscopy, the ABCDE method right here, as can be seen in this picture, and Breslow staging. Breslow thickness, the definition for that is like the thickness of a melanoma in millimeters measured from the top of the granular layer of the epidermis. And this chart here shows the risks as the melanoma tumor thickens. So these methods are not always effective. And again, that chart shows how tragic failing to detect melanoma early can be. So improved early detection methods are required so unnecessary deaths can be avoided. Canine olfactory detection and the electronic nose or eNose have shown promise in detecting melanoma. Melanoma cells produce volatile organic compounds or VOCs that can be detected by canine olfaction. In 1989, the first case of canine olfactory detection was reported by Williams and Pembroke. It was a Border Collie Doberman cross, which sniffed repeatedly at the patient's lesion through clothing, which led this patient then to seek treatment for the lesion. The patient did have superficial spreading of melanoma, but it was still at a stage that it could be removed. So then they concluded from that study that this revealed an olfactory origin of detecting melanoma. So detecting malignant melanoma by canine olfaction also deserves more research, as these VOCs can be identified. It's hard to see here, but they can be identified up to 1 part per trillion by canine olfaction. And this detection is a higher magnitude than gas chromatography and mass spectrometry techniques. So discussion and research is being done for the development of an eNose capable of detecting these VOCs similar to canine olfaction, and also certain eNoses in medicine are already in use. So this led me to seek out new and current detection methods for melanoma. The 3 methods examined in this study, for the study, were the S100 epithelial immunospot assay, or the EpiSpot assay. And a picture here of the immunospots at the end of the cell culture cell lines is shown there. The Nevisense electrical impedance spectroscopy is seen here, and the eNose, and this is a JPL eNose, which I'll talk about later. So these questions were researched for each detection method. How does the method detect melanoma cells? What are the advantages? What are the side effects or precautions? And how is the sensitivity and specificity of each method assessed? Then the methods were compared to see which method was most effective. It was also determined if the methods discussed were viable methods or further research is required. So the EpiSpot method was only tested with metastatic melanoma. It used 2 melanoma cell lines for optimizing the S100 EpiSpot assay, and each cell line was maintained in separate mediums. So viable CMCs or circulating melanoma cells secrete the S100 protein, which is being detected. 2 S100 antibodies were used to confirm the S100 expression in these melanoma cell lines for the assay. So then the S100 protein secreted by the melanoma cells would bind to these S100 antibodies, as shown in this diagram right here is what happens at the end of the assay. The cell lines are then immunostained with the 2 anti-S100 antibodies. And lastly, a fluorescent microscope with a camera and a computer analysis counted the single fluorescent S100 immunospots. So the advantages of the EpiSpot assay include, of all the proteins expressed and released by melanoma cells, the S100 family is the most studied so far by scientists. There were no side effects, as the patient's blood samples taken were carried out in accordance with the Medical Association Declaration of Helsinki, where the studies were done for this. This method has a sensitivity of 48% and a specificity of 100%. So 10 sensitivity is the ability of a test to correctly identify those with the disease, and test specificity is the ability to correctly identify those without the disease. So this was a higher sensitivity than the currently approved cell search method used to detect metastatic melanoma, which was only about 21%. The method is only limited to metastatic melanoma because blood is analyzed. So early detection of melanoma that is non-metastatic would not have the S100 proteins expressed in the blood yet. So further studies being done to improve this early detection. And there are certain antibodies expressed in the blood immediately after being infected with melanoma, and there are blood tests being created to detect these antibodies right now. The S100 EpiSpot assay was viable according to the research for the detection of metastatic melanoma, but improvement for early detection does require further study. So as seen in this diagram right here, the Nevisense system operates through small electrical impulses to measure the shape, size, and orientation of skin cells beneath the skin surface. It's equipped with a spring-loaded probe and disposable electrode, and the skin's moistened for 30 seconds with a saline solution. The voltage and current is limited to 150 millivolts and 75 microamps, which is not felt by the patient. So within about 8 seconds, the system has taken the measurements and computes a score between 0 and 10. Scores less than 4 are EIS negative, and scores of equal to or greater than 4 are EIS positive. So the advantages of the Nevisense system included higher accuracy than dermoscopy methods by dermatologists, and there are no invasive melanoma at stages T1 to T4 that were missed by the device. Stage 0, some were missed there because it has only breached the epidermis at that point, and sometimes the dermoscopic features can't be recognized. The safety of the Nevisense examination was successful, as there are no serious adverse events related to the device in the clinical performance, and the method had a sensitivity of 96% and a specificity of 34%. The reason, again, there were so many false negative readings was mostly due to small lesions with few or no dermoscopic features. This accuracy proved to be far above many methods, as no invasive melanoma at stage T1 to T4 missed again. The process of detection with this method is more complicated than the eNose and requires the patient to participate more, but is less time consuming for the doctor or scientist when compared to the S100 EpiSpot method. So the Nevisense method has proven to be a viable method in clinical trials and is being used by dermatologists in certain countries to detect melanoma already. The eNose is a small device that contains sensors to detect VOCs, or volatile organic compounds, as previously described. The device's sensor can be altered to detect here dimethyl disulfide and dimethyl trisulfide, compounds which are emitted by the melanocytes with melanoma. In one pilot study, the odor signatures of 2 organs, chicken heart and chicken liver, were used, and the melanoma tumor cell lines were recorded by the Jet Propulsion Laboratory eNose, or the JPL eNose. The eNose was able to distinguish between the 2 types of organ tissue and between the 2 types of tumor cell lines, but the specificity and sensitivity was very low. So the eNose advantages were that there was no contact with patients, and if canine noses can be replicated with an eNose, the specificity and sensitivity could rise to be above other methods. There were no side effects or precautions needed, as the eNose uses an olfaction sensor to detect the VOCs in the air around the skin or breath. And the sensitivity and specificity varied as low as 19 and 22% respectively. The eNose has the least severe side effects reported, but also is the only method not viable in clinical trials because of the low specificity and sensitivity, which may be in part due to the lack of funds and clinical trials done for the eNose so far. eNose's medical sensors first emerged in the 1980s, but were unable to deliver reliable diagnosis then, but are now improving greatly. eNose is also limited to detecting individual patterns and not individual molecules like mass or gas spectrometry can. The process of detection with the eNose is very simple and can be done very quickly if, again, the specificity and sensitivity can be increased. It has great potential for the future, but further research needs to be attempted. And this picture just shows the Cyronose 320, which is being used to detect individual chemical compounds in medicine or food industry already. So as these methods were compared, clear conclusions were made between these ways of early detection for melanoma. The S100 EpiSpot method was a reliable method that was the most time consuming. Further studies are being done to make it viable for early detection. Overall, it was ineffective for diagnosing melanoma in the early stages, but an amazing tool to use if one was seeking to detect melanoma in later stages. The specificity and sensitivity of the Nevisense was greater than all the other methods of detection and was more accurate than the experienced dermatologists, and surpassed all their methods, is currently in use again to detect melanoma in its earliest stages. it is clear that further research is needed to be performed with the eNose. There is evidence again that canine olfaction has succeeded in the past in detecting melanoma, but has not been accurate yet with the electronic nose. Therefore, it is not used clinically yet. So this research project showed the need for further research in early melanoma detection. There's clear evidence of the increase in melanoma cases each year, and a more diverse study on these methods would validate these findings. With the right team of researchers, an eNose based on the canine olfactory apparatus is possible. Many eNoses have been created already for different purposes, such as lung cancer detection, food quality monitoring, and even detection of viral and bacterial infections. So this technology could decrease also the use of costly techniques that are not as sensitive in detecting cancer and save lives. Overall, further research in this area may facilitate the development of more accurate methods of detecting melanoma and other possible malignancies earlier. So once it's frequently detected early and accurately, less human lives will be lost to this growing disease. Thank you.
All right, does anybody have questions for Kai? All right, I have one for you, Kai.
Yep.
So you mentioned the eNose was not very specific or sensitive. Did they give a range of ppm or ppt or anything like that, how sensitive it was compared to the dog's nose or something like a GCMS?
Not exactly. They do. It is nowhere near as sensitive as canine olfaction yet. Like I said, technology is improving with the eNose, but it still has a long way to go for it to become, as I said, like one in a trillion. The canine olfaction can detect molecules or compounds, and it's just not even close to that yet. So I didn't find though any exact numbers in that study.
Okay. Thank you. Other questions? All right, thank you, Kai. Okay, so riddle for the USEM students. This is your CAA activity riddle. So you can enter in your answer on the app, and you're free to Google the answer, or if somebody out in the audience knows, they can share the answer with you on the chat there. So that concludes our senior presentations for this semester. Next semester, we'll have 21 students, I believe, presenting. So that's something to be looking forward to there. If anybody has questions about anything, please feel free to send me an email and let me know. Otherwise, good luck on your final exams and the rest of the semester, and enjoy your break. Thank you again for attending.